All right. Welcome, Delegate Bartlett, Chief Hamill. Good afternoon. All right. Well, I will kick us off. So welcome, everyone, to our prevention work group. So we've got some wonderful presentations lined up for us today. We're going to start our evaluation, our inquiry into Maslow's hierarchy of needs. And we are, our co-chairs, this group decided to use food as the entry point into our investigation. As you all know, we're doing this dual framework of Maslow's hierarchy and an ecological model combined. So we're looking at not only those physiological needs to start on that lowermost tier of the hierarchy, but we're also kind of layering on an ecological look. Hey, Aubrey, good to see you. I thought I would just get us started. So I'm kind of giving a little background about why we're here, what we're doing today. We are very fortunate to be joined by Meg Kimmel, Chief Operating Officer at the Maryland Food Bank. Hello, Meg. Good to see you. Also, we've got from Maryland Hunger Solutions, Julia Gross. There she is, the Senior Anti-Hunger Program Associate for Child Nutrition. So we've got these two wonderful organizations here to share with us a bit about what they do, the programs that they offer, the needs that are being addressed, gaps and challenges. For further look into this at our September meeting, we'll have DHS present on this as well. So we're trying to really dig into this one area, and then we'll continue to go through the other areas. I think we'll go into housing after that, but we've got, you know, a wealth of information to look at and a plethora of people who are doing the hard work. So I know that we'll kick it off with the Maryland Food Bank and with Meg. I know she's got a PowerPoint, but before that, Aubrey, Donna, given that framing, is there anything you wanted to add to this context? All good?
I don't think so. Yeah, it sounded spot on for me.
I got it generally right. I sound as smart as one of you academic-y types, and that works for me. Okay, so Miss Kimmel, you have the floor. You have screen sharing capabilities. Folks will kind of come in as you are going, and we will keep an eye on the chat if there are any questions for you. But we will also have a discussion at the end of both of y'all's presentations. We'll save some time for that too. So group, if you have questions and they can wait, that's fine. But if it's like an immediate thing and you have an urgent need, you know, let us know. Mm-hmm. Meg, please.
Great. Well, thank you, Suki. Very excited to be here. I want to make sure that we, to introduce my colleague, Ann Wallerstedt, who is our Vice President of Government Relations and Strategic Initiatives. She's my counterpart in all things government relations and does a lot of this kind of work. So she'll actually be walking us through the PowerPoint today. And I wanted to share that we've had a little bit of a leadership transition, probably since we accepted this invitation at the Maryland Food Bank. And so as of July 1st, I'm the president and CEO of MFB. We had, thank you for the applause and excitement. We had a longtime CEO, Carmen Delguecho, who stepped down as of June 30th. And our board did a national search, and it turns out that the next CEO was already working at the Maryland Food Bank. So we're all really happy about that and excited to keep the work moving because it's a critical time, and the team was really concerned that we would lose momentum with the leadership transition. So excited that that won't happen. So what I thought we'd do today is I can just give you, again, I'm going to give you like a very 30,000 foot view of the Maryland Food Bank. We are always surprised by the fact that people are always saying, oh, I didn't know that, or I hadn't heard that part before. So we want to make sure that you're grounded in what we do and who we are as an organization. And then Ann will walk you through some of the more specific topical questions that we identified that we think will be of interest to you. But as Suki said, please guide us through this presentation. Make sure that we're sharing with you what you're looking to learn about and learn more about specifically. So very quickly, I'll run through Maryland Food Bank, founded in 1979, first food bank on the East Coast, the third food bank in the country. So that puts us at just about 46 years old or something like that. So that is about the age of food banks. They all started off as somebody's aunt or cousin, or I have some food and I want to make sure that it doesn't go to waste and that it goes to people who need it. Very, very basic, and has really evolved from there. Our organization now has 3 fully functioning branches across the state of Maryland. Our headquarters is in Baltimore County in Halethorpe, right near the airport. We have a location in Salisbury, and we have another branch in Hagerstown. We have 2 additional facilities. That one is a volunteer sorting center that's located in Baltimore County, and then we have another storage facility on the Eastern Shore for shelf-stable product. We have about 180 employees. We work with a network of about 700 community-based organizations that are the last mile that distribute the food that we provide. And sometimes, a lot of times actually, they have their own food sources too. So you think about MFB, we are the wholesaler, and then those food pantries or the feeding programs, schools, community centers, faith-based organizations, those are the retail, right? So that's the entry point where the contact point where food insecure Marylanders are accessing the food resources that they need. And this may be the last thing I say before I pass it to Anne, because I think there's lots we could say, but I think the last important thing that I'll share with you is that food insecurity hit historic highs during the COVID-19 pandemic. Our own research now shows that 1 in 3 Marylanders may be facing food insecurity today. That was what we experienced during the pandemic. That number has never come down. It has stayed at historic high levels, and in fact is now, we believe, going up even higher. Food insecurity affects people below the poverty line, at the poverty line, above the poverty line. You all know this well. And we watch things, so we have access to data, of course, we're very data informed. We watch things like Google searches for free food near me. And we're seeing those searches up 60% over this time last year. And we look at things like the level, like the Alice percentages and things like that. And so what we believe to be the case in Maryland is that food insecurity levels are now coming up over that 33% mark of 1 in 3 and are hovering somewhere in that 33 to 40% range. Even 33% it's jaw-dropping, it's a horrible number. We believe it's actually incrementally climbing up from there. So a really challenging time. This is all happening before there are cuts to Medicaid, before there are cuts to the SNAP benefits and the program. So we are fully taking a few deep breaths, girding ourselves for what's to come. And then the last thing I'll say, just to leave it on a slightly optimistic note, is that you have a really fantastic food bank here in Maryland. I know food banks. I've been working here for a dozen years. I know a lot of organizations across the country that are part of the Feeding America Network. Maryland has a fantastic and a strong food bank. We have an amazing team. So if any organization can help us navigate through this, what's coming, it's our food bank here in Maryland. So with that, I'll pass it over to Anne to get a little bit more specific and share some more details with you.
Perfect. Can everyone see my screen? The first? No. Oh my gosh. I have 3 monitors, so I'm trying to figure out what. Oh, goodness gracious. Okay. How about now?
Yes.
Great.
You did it.
Yeah. Show my screen anyway. All right, awesome, perfect. So I'm just going to jump right into this once I figure out how to do that. Okay, you see that next one? All right, I got my mouse in the right place. Perfect. So like Meg mentioned, it's really helpful to start with a picture of what food insecurity looks like in Maryland before I go into the next few slides about how the Maryland Food Bank is looking at the problem, is trying to tackle the problem, and how conversations like this can really help us in trying to address this in Maryland. So as she mentioned, 1 in 3 Marylanders are at risk of food insecurity. I've been, ever since we started tracking this, a good handful of years ago, this has been my main talking point. This has not changed. And as she mentioned, we know that it's increasing. Since pre-pandemic, we know that food insecurity has increased 25% in the state. And really what we want to talk about here today specifically is child food insecurity. And that's increased 12%. And a lot of what we talk about, I imagine Julie is going to get into some of the federal programs around childhood nutrition, and having that safety net and that floor there for child food insecurity is definitely going to be a focus of the Maryland Food Bank as well, but I won't get too much into what I'm assuming she's going to say. We also know that there's what we call the root causes of hunger, so the reasons that people are remaining food insecure, but there's also drivers of food insecurity. And one big one that we know right now is financial hardship. And we estimate that 39% of Marylanders are facing financial hardship. So that's everything. That's basically not being able to afford your basic household necessities, including food. And what we're hearing, the top reasons cited are high food costs and then high housing costs. And you can see here that food prices have increased. We all know this. We all go to the grocery store and we feel this pinch. But notably is this second one, where 11% of Marylanders are receiving SNAP benefits right now, but a full 29% are above that benefit level, but they're unable to afford some of these basic household expenses, with food generally being at the top of that list. Oh no, I spoke too soon. Here we go. There's also differences in the different areas of Maryland. We're really fortunate, of course, that we live in a state where there's mountains, there's rural areas, there's beaches, there's communities, there's cities. But with that comes a bit of a challenge. I mean, we're a small state, but there's a lot for someone like the Maryland Food Bank, a statewide organization, to tackle when we're looking at addressing food insecurity. We actually have what we call, regional program directors. It's a regional model. So we have, in 5 different areas across the state, people who understand those regions and are helpful in doing strategic planning and driving some of the food into those areas in a way that it can be received by those communities. So just by way of example of our areas, and then some of the hardships and barriers that food insecure Marylanders are facing in those areas. We have rural, right? Eastern Shore, Somerset County is one example there. Garrett County, of course, on the other end of the state. And they face a lack of transportation, a lack of public transportation, a lack of accessible transportation. And going along with that is just a general lower availability of jobs that are paying living wages, that are paying wages that can sustain a family out there. And in an urban setting, obviously Baltimore City, we're hearing from our partners is, just a lack of community resources, a lack of places where community members can access healthy and complete food options is really a struggle in Baltimore City right now. And then in some of our more suburban areas like Baltimore County, like Howard County, there's surprisingly a lack of transportation options. I mean, I live personally in Montgomery County, where we've got the metro, we've got bus lines, just this really robust transportation infrastructure system. And that doesn't exist in Baltimore County. It doesn't necessarily exist in Howard County in ways which can lead to food insecurity if you can't get to food. There's also less affordable housing in some of these suburban areas. And we know that housing and food insecurity really are intrinsically linked. So the Maryland Food Bank in 2025, as Meg mentioned, we were founded in 1979. So we've done this for a while. And now we're really getting into being a very data-driven organization and really looking from, this bird's eye view of the entire state, what is needed, and then taking it down to this regional focus. So using this model, we've been able to annually distribute over 50 million pounds of nutritious food all across the state. And that's just a massive a massive, massive number. But that's what it's taking. And we know that we're not we know we're not meeting the eating needs of every single person in the state. We have 780, like Meg mentioned, partner organizations who are either running our programs or distributing food that we provide for them, which I'll break down in the next slide. We also partner with local agriculture. We contract grow. They allow us to glean, and then of course we receive donations from farmers. We receive them from ag producers, dairy farms, egg farms, and then processors like seafood processors. We get some blue catfish that comes in as well. It's really important for us as a statewide food bank to be able to contribute to our local food system in the efforts of strengthening that local food system. We recognize that we're a major partner for a lot of these organizations in agricultural farms. So making sure that we're supporting them as best we can is definitely a top priority. And then, as I'll get to in a minute, we also recover food from retailers all across the state. We facilitate distribution directly from the retailers into our local food pantries, which is keeping food in the community. It's close by, it's quick, and that's really helpful for our food pantries as well, to have a diversified offering of food, of local food, to be able to distribute out to food insecure Marylanders. Now, with all this great work, particularly in this last year, comes challenges. In the past handful of months, we've lost federal programming dollars, especially for programs that the food banks are uniquely benefited by, which has been challenging. We also know this feels like a year ago, but it was really only a week ago, that we're going to be experiencing cuts to safety net programs like SNAP and Medicaid. And we know that Maryland is going to be on the hook for hundreds of millions of dollars if we want to keep the status quo that SNAP and Medicaid have been able to provide the state. So that's absolutely going to be a challenge that we're going to be a part of that conversation to, figure out what to do in that situation. But most importantly is, while this is all going, on at the government level, Marylanders are going to be feeling these pressures. There's going to be work requirements. There's going to be other administrative burdens. And when you're already facing food insecurity, hunger, trying to figure out where the next meal is going to come from for your family, and we know that you're not hungry in a vacuum, right? There might be other things you're struggling with, like we all have in our lives. This is just going to be that one more difficult thing to tackle. And that's really concerning in a state like Maryland. And then, of course, as we mentioned, this high demand for food assistance that just really hasn't gone down is really, something that we're working on meeting. However, because we've been doing this for so long, we've learned a thing or two along the way that's really helping us direct some of the strategic and programmatic work that we're doing in the state. Food banks used to be, food in, food out, food distribution type organizations. And while obviously that's, as I say, like the bread and butter of our work, that's what we do. We also recognize that when we're able to provide food and take that financial stress off of families, that brings some economic relief. Because if your household budget is a finite amount of dollars, if we can take this bucket out of the way, then that's going to free up dollars for other areas of your life and places that you need. So we're really proud that we're able to really take a kind of a holistic assistance opportunity for a lot of Marylanders. We also know that Meg mentioned that food insecurity is just not limited to those with very low incomes. And as I mentioned before, while there are a lot of commonalities that exist in our food insecure populations, really there's a lot of unique barriers to food security, which is part of the reason that our regional program model we think has been so successful in trying to tackle some of those specific things. So second to last slide here, these are some of the programs that we offer. We do kind of a two-sided programmatic model where we have programs that we offer with staff who run some of these, and then we also have these community locations that distribute out the food that we provide to them. So just to pick out a quick one, here we operate a program called Mobile Market, and that is basically a grocery store on wheels, like a food truck that we take out to mostly rural areas in the state, places where there is not access to transportation, access to, you know, healthy varieties of food, and we're able to provide some food distribution events in those places. We also, you know, especially in times like this, we have these community locations, food pantries, faith-based organizations, you know, schools, places that families are comfortable with, they're familiar with, and they're already there. So it's really important for us when we're planning strategically of who to partner with, what organizations make sense, that we keep that perspective in our mind to make sure that where we're providing food is a place that people will come to get food and they feel safe and comfortable and frankly dignified to be able to do so. And then lastly, you know, we were really excited to get this invitation because, you know, we try to not work just as an anti-hunger organization. We really recognize that our work is truly an anti-poverty, you know, anti-poverty work that we do broadly. And it really is going to take the entire state to tackle this issue. We know that coordination between state agencies is crucial. You know, I see that there's different state agencies on this call, which is fantastic because everyone has different areas of oversight, different programs they run, you know, et cetera. But with that, of course, you know, an engaged philanthropic and business community as well, because, you know, these issues are not just poverty issues. They really impact the entire state. So making sure we have that buy-in is crucial. And lastly, those neighbors who are facing food insecurity, who have that lived experience. So when we're talking about these barriers, when we're talking about how to increase food insecurity, we're hearing from people who understand the issue because they've lived it. That's really important, especially when we're talking about, you know, passing policies at the state or the county or the local level to have that input. Lastly, the recognition of expertise. You know, we can't do it all. We are not a legal aid organization. So if someone, you know, comes to us and they need healthcare assistance or expungement or, you know, and food assistance, you know, having strong partnerships in the community, recognizing that they're really good at what they do, we're really good at what we do, is really just a crucial, humbling step back to make sure we're all bringing our best selves forward as organizations. And actually, this is lastly, having this strong safety net. Really having this foundation where if you're hungry as a kid and you go to school, you can't learn. Having this foundation, whether that's from legislation, policies, state, federal level, is really crucial to all of this work that we're doing. And I think we're finding out now, we're going to be finding out the next few years, probably really foundational to food security work. And with that, I will open it up for questions.
Thank you so very much. And that was fantastic. Yes, you're getting rounds of applause. So important and so informative. I think maybe we'll wait, if that's okay with you, and Donna and Aubrey, if we hold off and the rest of the crew here. But also really thank you for giving us those recommendations at the end. That's so important to the work that this group is trying to put together, this kind of blanket, this kind of looking at that safety net across all of these quality of life areas. Really important to the work, and we're going to be capturing all of that and, you know, sharing that up with the commission and then farther up and, you know, up the chain as things carry on. So for now, we'll pass it over to you. Where did you go? Did we lose?
Julia's still here.
Okay. Oh, there you are. I don't know why I did not see your square right there. All right, Julia, let's hear from you, and then we will open it up afterwards. But please go ahead.
Great, thank you. And I also have some slides, so let's see if I can do as well as Anne did with getting these up and running.
We can see it.
Okay, great, perfect. All right, let's see if I can get in presenter mode. Oop. All right. All right. Well, I don't have any as many screens as Anne, so I'll just go with presenter mode, and hopefully you all can see that. I lost sight of everyone, so just let me know if it's looking good.
It's
Yeah,
not in presenter mode, but it's
Yeah.
we can see it. It's big enough for us to see it, but we can still see like the depth of upcoming slides on the side. But it's fine, I think. If somebody else speak up if you're having issues seeing.
It's fine. Yeah, it's not in presenter mode, but that's not an issue. I always get worried once I start pushing buttons. Oh, there you go. Yeah, beautiful.
Okay. Oh, perfect. Okay. All right. So thank you for having me. I'm so glad that we were paired up with our good partners at the Maryland Food Bank. I feel like we are covering very similar things, but also do very different and complementary work. So I'm happy to be here and be sharing with Anne and Meg. So thanks again for having me. My name is Julia Gross. I am with Maryland Hunger Solutions. And so who we are a statewide organization working to end food insecurity in Maryland. We were founded in 2007, so a little bit younger than the food bank. But we are a state initiative, one of two state initiatives of the Food Research and Action Center, also known as FRAC. So they work at the federal level, doing education and policy around the federal nutrition programs. We do very similar work here in Maryland with the addition of our outreach branch. So we do work with the state to do SNAP application assistance. We are one of the state SNAP application assistance partners, and we are able to do that statewide. So we have a toll-free number that anyone across the state can call to get application assistance if there's any sort of language barriers that they might need help with or internet access barriers. We always say that doing a SNAP application is somewhat similar to doing your own taxes. There are a lot of folks across the state who do that very well on their own and are able to navigate that, but sometimes folks need a little bit of help too. So we're always there to provide that if needed. So backing up a little bit, I know Anne and Meg addressed some of what food insecurity looks like in Maryland. I just wanted to give a quick definition of what food insecurity is. So kind of looking at the USDA definition, this is talking about the reliable access of affordable and nutritious food needed to live a healthy and active life. And so there are some questions here that I listed to help screen families. We work a lot with partners to help screen families for food insecurity and refer them out to programs and kind of food assistance programs and charitable programs like food banks. So looking at the accessibility within the last 12 months of food, whether folks were worried about their food running out, their ability to eat food if they were forced to skip meals, or were hungry and not able to eat meals because of concerns about money. So these are some of the ways that we kind of define that food insecurity status, and this is measured at the household level. So we're looking at the household as a whole. And this is very different from, when we say hunger, that's kind of a shared experience that we all have, right? That's an individual status that may or may not result from food insecurity. But I think, one of the main differences is, we all experience hunger and can empathize with that, but really taking the time, in presentations like this to understand the experience of individuals and families that are experiencing food insecurity is so important, because not everyone has that shared experience. And so we really need to learn a lot from the folks who are experiencing that on a daily basis, and how that impacts their life and their choices. So looking at kind of the overarching themes within food insecurity, and hit on this a lot, there are a lot of underlying causes and kind of factors that cycle into that that kind of cycle and system of food insecurity. But looking at the availability, access, and adequacy of food in the community is really important. We know Maryland is one of the wealthiest states in the country. There's no lack of food in the state. There is adequate amounts of food in the state for everyone, but it is not always accessible, and there are a lot of barriers that prevent folks from gaining access to that food, whether that is because of poverty within their household, and the affordability aspect of that, or whether it is kind of a community level. There are community level barriers like transportation, and availability of grocery stores, or lack of availability of grocery stores, that we see a lot throughout the state. And then kind of building off of what Anne mentioned around the food insecurity levels within Maryland, like they both, Meg and said, there are Marylanders experiencing food insecurity who are living in poverty, but we're also seeing that demographic really expand. And so it's not just folks who are living in poverty. It's, growing beyond that. It's always been beyond that, but it's been kind of growing exponentially over the past few years. And actually, I think it was Capital Area Food Bank that came out with a really great report that highlights how that demographic has shifted, and we're seeing growing levels of food insecurity among households with a kind of that median and higher income status. And I think that was really highlighted during the pandemic, and we're seeing it a lot now as well. But during the pandemic, our SNAP application team and our SNAP outreach team were getting calls from folks who had never needed assistance before, and we're navigating that system for the very first time. And similarly to today, we're seeing kind of that shift, and folks who are or maybe working at the federal government and calling because of the unemployment there, and have never navigated the that food resource safety net program, safety net system before. So it's really important to kind of recognize that these numbers are very high, but also recognizing that there really is no face of hunger, face of food insecurity. I think the perception and kind of what people think of when they think of these issues is not what we're actually seeing on the ground. You can interact with a number of people in your community, and you may never know that they are experiencing food insecurity. And so just recognizing that, I think, is also a really important issue or a really important aspect of understanding what is actually going on within Maryland and within the country as a whole. So looking at the consequences of food insecurity, so we do a lot of research, and FRAC, our parent organization, is a research-based organization. So we look a lot at the health repercussions, and not just health, but social repercussions of food insecurity. So this is not a comprehensive list, but a list of some of the issues that we see a lot of children having health issues, whether that is stomach aches, headaches, being sent to the nurse at school more often, hospitalizations, as well as kind of social issues around being more disruptive in the classroom. We see that a lot when students are experiencing food insecurity. And then within adults, there's a much more high likelihood of experiencing chronic diseases such as diabetes, hypertension, and kidney disease. There's also mental health issues related to food insecurity around stress and anxiety and depression. So just kind of noting that a lot of these things kind of go hand in hand and can kind of lead into that again cycle of like when you have some of these health consequences of food insecurity, it limits the ability to oftentimes work or attain educational achievements and just kind of funnels into that a cycle of poverty and not being able to access all of the resources that are needed to thrive. So what we do at Maryland Tiger Solutions, like I mentioned, we do SNAP application assistance and outreach. We also provide education and awareness. Our SNAP team does trainings as well. So we work a lot of times with, school districts and like administrative staff and community school coordinators, working to share a little bit about the different programs that they can provide to their students and parents. We work with community partners on the ground to provide that training as well. In terms of technical assistance, I can speak to the work that I do with schools. So I am focused on child nutrition programs and very heavily on the school meals and out of school time meal programs. So providing technical assistance to the school nutrition staff in terms of implementing best practices like breakfast after the bell, and the community eligibility provision, which is a way that schools can provide free meals to all of their students without an application. And then different awareness campaigns that I'll touch on in a little bit. And then our other branch of work that we do is around advocacy. So we work really heavily with policies at the state level, a little bit at the federal level as well, although a lot of times we let FRAC lead on federal advocacy, but we do work on state level policies to supplement the existing federal nutrition programs and try to expand access and remove barriers to those. And then of course, doing all of this within partnership of different folks across the state, like the Maryland Food Bank. We also work with legislators, researchers, food councils, and I'll touch on that a little bit in a bit too. But we can't do this work alone. There's such a broad base of kind of work that needs to be done across all different sectors to make sure that we are addressing all of the areas that need to be addressed to ensure access to food across the state. So couldn't do it without our coalitions and partners. So these are the federal nutrition programs. When I talk about the programs that we work with, this is the list that we focus on. This is not a comprehensive list, but we focus very heavily on SNAP, WIC, the school meal programs, and out of school time meal programs. I don't have a slide on each of these. I probably could have made a whole presentation on every single one of them, but I'm happy to go into a little bit more detail about how each of these programs work if folks are interested. But to save time, I'll leave that for connecting afterwards. But I just wanted to kind of create a list of the programs that we really focus on in terms of our policy and outreach. And then challenges and barriers. So there's always going to be stigma around a lot of these programs. What we're seeing now, I think the pandemic really helped with that stigma. Like I said, a lot of folks came to us for the first time needing assistance. And, I think that experience really showcased that there are a lot of people in Maryland and across the country who are one emergency away from needing this kind of assistance, from needing SNAP, from needing TANF, from needing food banks. And so that helped to alleviate some of the stigma, but it's always going to exist. And one of the bigger challenges that we're seeing now is less stigma and more fear. I think this is something that we saw in the last, not the last administration, but the last round of this administration with some of the immigration policies. We're really seeing that impact our immigrant and mixed status families. I've heard from our SNAP team that we've been receiving calls with families wanting to be removed from SNAP and not wanting to have their information in the system at all. And so I think that's a new, not a new challenge or a new barrier, but it's something that is growing. And something to really, make sure that we're keeping an eye on and try to mitigate as much as possible to make sure that those families are still receiving the assistance and resources that they need. Benefit adequacy has always been an issue as well. SNAP has never been fully adequate to cover the cost of household food needs. And so kind of trying to supplement that at the state level is one of the things that we've always tried to push for. And then there are other issues around language access and of course, like difficult processes that sometimes folks find challenging as well. And then Anne also mentioned the federal cuts to the program. The state budget has also been a challenge in recent years, trying to get some of the additional policies that we're trying to supplement these programs with passed. But those federal cuts are really going to be, I think, one of the biggest stumbling blocks that we have to deal with over the next few years of just really trying to figure out what those impacts are, not just to the programs that were directly cut, but what those trickle down impacts are going to be across our entire safety net, because a lot of these programs are intrinsically linked in a net. And so when you cut one, you see that that chain effect down the line. And so I think we're going to really have to keep an eye on that as well, trying to figure out how those cuts are impacting school meals and other programs like Sunbucks, and how we can help that from really getting out of hand. So in terms of outreach and education, these are a couple of our outreach campaigns that we've done. We've done paper apple campaigns and social media campaigns. And these are really great, particularly around getting the word out to our legislators. So I won't spend a ton of time going over these, but just some of the examples of what we can do to help get the word out to those policymakers about how important these programs are and really getting the stories across to them. I always say that, I could talk to them for hours about how these programs work, and it's not going to stick as much as one story from someone who has actually experienced these programs and the benefit and change that it's made in their lives. So I think this is one of the greatest ways that we can get that across and really make a difference in terms of the support that we get at the policy level. And then these are just some of the examples of the wins that we've had in Maryland. We're very lucky that we have a supportive legislature when it comes to SNAP and school meals. Like I said, the budget has been a challenge last year, for a couple of years now, but particularly last year, the budget has been a challenge, and I know we're expecting that to continue to be a challenge in this upcoming legislative session. But Maryland has made some great strides, and we're still working on continuing campaigns around expanding access for school meals. As you can see, Healthy School Meals for All is an ongoing campaign that we're working on. And then, of course, SNAP adequacy. So we're always trying to increase the supplemental benefit that Maryland provides as well. And then here's just another list of our partnerships that, you know, folks that we work with across the state. I just wanted to highlight here all of the food councils that we have across the state. There is a statewide Maryland Food System Resiliency Council, but there are also a lot of local food councils that do really important work on the ground level as well. So Montgomery County Food Council, Prince George's, Baltimore City Food Pack, have all been longstanding councils. We have some newer councils developing in Anne Arundel County, Baltimore County on the Eastern Shore. But those folks are really important to kind of collect those stories on the ground, but also coordinate. You know, I know Anne mentioned some of the work that's that they do on the agricultural side of the food system. And I think the food councils are really important partners to coordinate kind of the links between you know, that agricultural sector and food providers and food growers with kind of the food banks and schools and other institutions, and making sure that the entire food system is kind of looked at that that local level. And so having them as partners is really a key piece of this work as well. So just as a recap to this entire thing, I know you all are looking at kind of all of the hierarchy of needs, and kind of food being the base level. But I think the takeaway from this is, you know, when Marylanders have access to the supports they need, they have options to make better choices for their health and well-being, which then goes up into all, you know, out into all aspects of their lives. And I just wanted to share a story that I heard actually a couple of weeks ago. I was visiting one of the schools in Western Maryland, and their nutrition department had partnered with a group of inmates actually from a prison who had decided to volunteer their time to collect food for one of their backpack programs. And so they went to the prison and actually spoke with these inmates around, you know, why they were doing this work and, you know, what was motivating them. And one of the inmates said, you know, this is really important to me personally, because when I was a youth, I made bad choices because I was hungry. And so I think that kind of underlines the need for all of these supports, and really just kind of like sticks as a story with me, at least, about how just having that access can make such a huge difference with individuals and families in their lives. So that's where I'll stop. Feel free to connect with us. You know, if you'd like to stay in touch and get involved with any of our campaigns, feel free to reach out to me. Our toll-free hotline number is also in there that you can share broadly. Like I said, we do statewide work. So feel free to share it with anyone in any county across Maryland. So I'll go ahead and stop sharing there, and happy to take questions.
Yeah, that was fantastic. What a great couple of complimentary presentations. Very sobering indeed. Aubrey and Donna, I think we probably got time for a couple questions. Aubrey, you unmuted. You want to lead us?
Sure.
Or?
Yeah. Well, thank you guys. Thank both of you, or all three of you, very much for this presentation and your respective presentations. It was really eye-opening, and I think he said it best, sobering. One of the points that really stood out to me was about the teenagers and the increased risk of suicide, with 5 times more likely to commit suicide when they're experiencing hunger. And I'm curious as to like whether there are, like, how we got that data, and if there are ways in which we can start doing some really more like sophisticated data collection, maybe specifically on youth who are involved with the system and the hunger that they're facing. And was wondering if you guys know of any ways in which we could get that data, or if that has been attempted in the past. It'd be great to hear your thoughts about how we need to go about it if it's never been happened. If you have tips about, like, who we need to make sure has connections to who and what MOUs and all of those, it'd be great to hear your thoughts.
Yeah, so I'll say I pulled from the slide that I shared, I pulled all of that from one of our resources with the Food Research and Action Center. So I can go back through and, find their sources and send the actual research to you if that would be helpful. I don't know of kind of youth groups across the state per se. But I will say one of our strongest partners in that youth space is Heart Smiles. I'm not sure if folks work with them at all in Baltimore. So they are Baltimore City based. But Joni, who leads Heart Smiles, is incredible. And that group of youth is also very incredible and incredibly active in terms of advocacy, very vocal in terms of what their needs are. And so if you're looking for that kind of input from a youth voice, I think they would be a great place to start.
Thanks so much.
Yeah, and I would plus one that, and I'm blanking on Joni's last name, but she leads an incredible program. We struggle pretty mightily, Aubrey, to understand the data at a disaggregated level. From our perspective, Feeding America Food, like our food bank and other food banks across the country, sometimes our partners will take intake data, but we also try to make our food distribution programs as accessible and low barrier as possible. So we actually often choose not to do that. And the other thing I would offer is a couple things. One, we know that primarily it's heads of household or women who are coming into the charitable food system because they're willing to do that, whereas other family members may not be as willing. And so that would skew the data in any regard. They may be picking up food for teenagers or older adults, but they wouldn't show up in the data anyway. And so the other thing I wanted to share is that we have, and I'm just dropping this into chat now, we have an ArcGIS map that is called our Maryland Hunger Map, and you can toggle on and off layers there to see where all of our programs are located. So just as a general resource for the work that you do, if you have an organization that's based in Anne Arundel County and is looking to understand, are there out of school time meals that the Maryland Food Bank provides? Are there food pantries? Are there mobile produce distributions? Are there the mobile markets that Anne talked about? You can actually look for those things specifically on the map. And understand what organizations are coordinating those services locally in each community or each jurisdiction. So that's a good resource just to share around. We built it so that our programming would be transparent and visible externally to foster partnership and also to make it easier for people to access those food resources. So please feel free to explore that. There are demographic layers in there. There are SNAP application and eligibility layers in there. So we tried to touch on social determinants of health, sort of drivers of food insecurity in the map as well. Not being a public health organization, we did as much as we should reasonably do. But again, if that generates more questions or an interest in follow-up conversations, we have, Anne and I have another colleague who's hands-on working on keeping that map updated, and the data is as current as it can be. It's not like one of those maps that sits out there and then the data gets old. We work really hard to keep it as fresh as possible. So just wanted to share that resource.
Thanks so much.
Yeah, I wanted to jump in. It's similar to Aubrey. I picked up on the 74% more likely to engage in socially disruptive behavior because it's so relevant to why we're here, which is preventing juvenile justice involvement. So I guess, one, yeah, just like Aubrey, I'm curious about where that data comes from and how it's collected in that research. So if that could also be pulled and sent along, that would be great. But I'm also, how much of that correlation is the hunger itself, and how much is there some other common adverse childhood experience that's underlying both of those, right? The hunger and the socially inappropriate behavior are both being driven by a third factor. And if there's research that kind of would tie that together. And I'm not expecting you all to have the answer, just putting it out there for the work group is something to think about and look into.
Yeah, and I would say that just conversationally, we talk about this a lot, and food insecurity is a symptom of an underlying issue, and the issue is a lack of financial resources. Mostly, it could be access to safe housing, which is also related to a lack of financial resources. So that is why we also offer a culinary training program. We offer another workforce development program. So we're also trying to work the other side of the food security coin, which is helping to understand what's causing food insecurity and helping to do what we can to mitigate those root causes. So we can take that, maybe Ann and I can take that to our colleague Daniel, who's our researcher, and see what he can come up with in terms of it's going to be access to it's going to be financial stability is what causes food insecurity. But we'll see if we have some ready resources to share over with you on that.
So then when a family presents in need of food, is then there a connection to social services, or like what happens in terms of helping them get to the place where they no longer need the food bank? How do we get them to a place where they are more financially stable and able to provide? What does that process look like?
Yeah, I mean, that's the vision. And it looks different depending on where you go. So all those 780 organizations that Ann mentioned are all independent 501c3 or faith-based organizations. They run their own programming. So what we do is we try to provide connections, and we work really closely with Department of Human Services. So access to healthcare, utility assistance, and SNAP that's kind of a bundle that we make sure is out there. We have outreach team, just like Julia mentioned, and community navigators who are people with lived experience who are helping to spread the word in their communities, trusted individuals. So we are trying to build every bridge that we can to those wraparound services. But it's not quite as linear as we're always going to be feeding people. That's where the need is. That's what we do. It's part of what we do. And we also do the root cause work. So we're trying to build sort of like from both sides of the bridge and come together. Our FoodWorks program that I mentioned before it is a complete circle where we have a case manager on staff. We have an employment specialist. They get the students get stipends, they get transportation, they get all kinds of food while they're in the program because it's not paid. They do get a little stipend, but it's not paid. So we understand that full circle of intervention is what's really needed to get, help folks stabilize and thrive. So, we're trying to just take that model out and share it out as broadly as we can with as many organizations as we can.
Can you repeat the name of that model again?
It's a FoodWorks culinary training program. Okay, sure.
And I'll just add on to that. So we do similar work with our SNAP application assistance, where if folks are in need of immediate assistance, we generally refer them out to a food bank partner or a community organization on the ground that can do more immediate assistance, or other programs like if they need help with paying their internet, help with rent and housing, help with energy assistance. There are other folks that we can refer them out to. But I also wanted to flag, Ann mentioned in her presentation around the increased work requirements with SNAP and Medicaid. And I think it's really important to note that most of the families and individuals on SNAP and Medicaid are already working. And the reason that they're on these programs is because their wages aren't enough or their hours aren't enough. And so it's not just a system of being able to connect them with enough social safety net programs that they can make ends meet, because sometimes that works and sometimes it doesn't. But it's also, the system of, making sure that we have adequate wages and employment opportunities, and it expands broader than what we're just talking about today. And so I think that's an important piece to kind of put into the conversation as well.
Truly informative. And I thank you again, Julia and Meg. I want to respect folks' times. We're a few minutes over. We will come back to you with any other questions, and I'll definitely follow up with you as well. I'm sure folks would love to get their hands on your presentations if they can as well. Just a few things. This group will meet again in September. We're going to give folks August off because folks are traveling and all of those things. So we will note that. You'll see a calendar cancellation. Also, we'd ask y'all to review the prevention summary, work group summary by today. If you feel there were very few changes, I think there was a clarification that one of the meetings didn't have as much emphasis on a thing, and I changed that. So if we're good there, if you can give me a thumbs up, that's great. If there's an issue, then I'll go and I'll come back and we will talk that through. But I think that looks pretty good to go. Co-chairs seem good. If you need to reach out, let me know. I'd love to hear back from you about that as soon as possible if there is an issue. But thank you again, Julia and Meg. This has been a really great start to this process for this group. And there will be so much more, but really you've gotten us off to like a really strong start. So thank you. Have a great rest of your week, everybody.
Thank you so much. We're happy to help.
Thank you. Thank you all for being here.
Thanks so much.